Well, welcome to the 2025 Medicare Update. My name is Dawn McConnell, and I'm here with my friend Laverna Whitcop. And every year, Laverna and I try to do our best to update you and prepare you for the changes that are coming up in this coming Medicare year. This year, unlike others, we're trying to simplify our presentation and just give you the highlights of the subjects that we find will be most impactful for you. So instead of an hour video, we're hoping to keep this one nice, short, and sweet for you this year. At Ford Insurance, we are an independent insurance agency, and this is important to you because we can represent any insurance company that we wish. Currently, we're working with Priority Health, Blue Cross Blue Shield of Michigan, Blue Care Network, Cigna, Aetna, Humana, and United Healthcare. Some of those are new to our tool belt this year, and we like to have all of those companies in our tool belt so we can be as transparent as we can in our recommendations and give the most informed advice that we possibly can. Now, there are plenty of other carriers out there, and currently, at this point, we're not seeing it necessary to have those carriers in our tool belt, but we're always looking every year to see what's out there and what's most helpful for you. But today, we're going to just be looking at the coverage changes through Blue Cross Blue Shield of Michigan, Blue Care Network, and Priority Health, as these are the plans that the majority of you are on. So let's start off with Blue Cross Blue Shield of Michigan.
For all carriers each year, they must send out an annual notice of change. Here's an example of the Blue Cross Blue Shield for last year. This is what they look like when they come out. We are asking you to look these over each year when you receive it. This will tell you exactly what all the changes are with your plan for that particular year.
For Blue Cross Blue Shield and Blue Care Network this year, there's no changes to the number of plans that are being provided, but there are a handful of plan changes. So we're going to look at some of those plan changes. One of the big plan changes this year is the maximum out-of-pocket. They're increasing that maximum out-of-pocket on a lot of their plans. Now, the Meyer plan and the Essential plan are two plans that the majority of you who are on Blue Cross and Blue Care, those are the plans that you guys are on. We're seeing the Meyer plan is increasing from $5,200 max out-of-pocket to $6,750. And the Essential plan is increasing their maximum out-of-pocket from $5,200 to $6,250. We're also seeing an increase in the premium of the optional enhanced dental and vision on the Blue Cross Blue Shield plans. One of the biggest changes to the Blue Cross Blue Shield is the prescription formulary. For most of you, again, you're on the Essential or the Meyer plan, and we've had just one prescription formulary for the majority of these years. They are now separating their prescription formularies into two different formularies called the Healthy Value and the Core plan. So the prescription plan that's embedded into your Essential and Meyer plan is moving from the more robust coverage to a lesser coverage called the Core formulary. This is covering 400 less prescriptions for you guys. So if you are on a Blue Cross Blue Shield plan, please call us to make sure your prescriptions are still being covered. This is a concern for me, for Laverna. I'm personally not happy with this change, and so again, I'm just calling this out. If you're on a Blue Cross Blue Shield plan, it's going to be really necessary to make sure your prescriptions are being covered efficiently.
Now let's talk about the key changes to Priority Health. For all carriers each year, they must send out the annual notice of change. We talked about that with the Blue Cross plans, and here in this slide is a sample of what the one looks like for Priority Health. We are asking you to look these over each year when you receive them. This will tell you exactly what all the changes are for your plan. Now, I want to point out that I personally get my annual notice of change electronically. I just got it yesterday and I was just so geeked about it. It not only went over the changes to my plan, The annual notice of change, everything that anybody would get in paper is in this email that I got. And they had videos attached to it to show exactly what the changes are to the plan. So that's one of the reasons why we wanted to cut back this video, is because we knew that those videos were coming out to you this year. So pay attention and watch those videos.
Yeah, and if you don't have your notifications set up to be delivered to you electronically, for the most of you watching this video, you got this video sent to you via email. In the body of this email, we are putting the links to those individual annual notice of change videos that Priority Health has. They're also going to be listed on our website. So just make note of what plan you are on with Priority Health, and then find the link that matches to that accordingly.
We find them to be extremely helpful.
They did a really good job with it.
They did a really good job with this. Priority Health is also simplifying their options. They went down from 13 plans to 10. And again, this is good news. So as you go through this, you're going to see why we say this is good news. Some of the plans will be going away, but rest assured, if your plan is going away, you will be automatically crosswalked into a very similar plan with similar benefits. Here's the specific ones that are being changed up. If you're on the Compass plan, you will now be crosswalked into the Thrive plan. The One plan is going to Vintage, the Select plan to Merit. As a side note with all of this, I personally am going to go to the Thrive plan, and here's the reason why.
You're currently on the Key plan, correct?
Oh yeah, that's correct. Thank you for reminding me of that. I am currently on the Key plan, but I am planning to go to the Thrive plan, and here's the reason why. I'm officially a snowbird.
Yeah, she is.
And we go south for anywhere from 4 to 5 months each winter. I have a doctor down in Florida that I like to consult with, and they like the idea of having PPO, Preferred Provider Organization, behind the name of my plan. The Key plan is HMO, Point of Service, Health Maintenance Organization with Point of Service option. The Thrive plan that I plan on switching to is a PPO. And for whatever reason, don't even ask me why, but they like this PPO acronym better than the HMO, Point of Service. I know, and I have experienced, that the two plans work exactly alike. I mean, all you have to do is show them your travel pass, and they work exactly alike. However, this clinic that I have in Florida just likes the PPO, and they tell me they won't budge. So if you're in that kind of a situation when you want to establish yourself with a provider in another state, and they happen to like the PPO option better on their end than the HMO Point of Service, let us know. We'll move you. And so that's why I'm moving to the Thrive plan this year. Your circumstances, maybe you don't go south for the winter, so I'm going to say don't worry about it.
And if you're only going south in the winter for a short amount of time, your emergent and urgent needs are always going to be covered no matter what plan you're on. So you don't need to worry about it if you're just doing short term.
Yeah, I'm just talking specifically when you want to doctor. I want to go consult with a doctor down in another state or something like that. So, okay.
So Priority Health still, even with some of these plans going away with some crosswalks, they still have a great offering of the $0 premium plans. However, starting in 2025, these $0 premium plans are going to have a very small deductible. This deductible is a per year deductible. We're seeing anywhere from like $200 to $500 for these deductibles. So nothing we're too concerned about. And also, I want to just say, don't let the deductible scare you. The deductible is not applying to many of the services that you do on a routine basis. So seeing your primary care physician, seeing a specialist, any chiropractic or physical therapy, occupational therapy, speech therapy, there's a whole list for you to see there. From outpatient labs and tests and ER, urgent care, observation, all sorts of stuff. The deductible does not even apply to that. So your co-payments kick in just as they always have. This deductible that you'll notice on your annual notice of change, it will apply to some of our bigger items. such as an inpatient in the hospital, skilled nursing facility, cardiac and pulmonary rehab, some of the bigger diagnostic radiologies, your CAT scans and MRIs, things like that. So we don't want you to get alarmed by this deductible because really it's not a scary thing at all. And you'll notice in your annual notice of change, they're making a lot of things better in your copayments.
Oh, yes.
So we knew there was going to be some big changes to the Medicare plans here for 2025, and we're actually quite pleased with what Priority Health has done.
Yes. The plans that have a premium will not have a medical deductible. Also, we should note that Priority Health has the same prescription formulary across all plans. Unlike what we have seen with some other carriers, you can be rest assured that your prescription drug program is going to be the same no matter what plan you're in.
All right, so we're going to call out a few of the Priority Health plans. I like to do this just to keep it real straightforward, real cut and dry. Here's our plans that we like. Here are plans we still like, but maybe it's not the best fit for you. So we're going to call them out here. The plans in green, the Priority Health Edge, Key, Thrive, Vital, Vintage, and the Thrive Plus. If you're happy with that plan still, we're happy. Mm-hmm. These are still great plans. We are highly recommending them to our clients daily. So we like these plans. If they've been working for you, stay there. We gave it the thumbs up. The plans in red, the Priority Health Medicare plan, the Merit plan, and the Value plan. Now these are all higher premium plans. And I think it's just a good idea if you're on these plans, call Laverna or myself. It's time to review these plans to see if it's still the best fit for you.
Bottom line is that anymore, it's almost, especially with Priority Health as a company, it doesn't make sense to be paying premiums for your insurance anymore. If you compare that with what the plan itself does and with the out-of-pocket maximums and such. We continue to recommend the Priority Health plans as usual. This year we received the J.D. Power Award for customer satisfaction. In fact, I got my notice just today in the mail, and it looks like this. You'll get this notice in the mail for Priority Health customers. It will talk about this award that they got. This has all to do with how their customer service works. As an agent, I've always been very impressed with their customer service, but for you as the consumer, this is proof that what we were explaining to you is correct with this award that they got.
Yeah, and Priority Health was the only plan in Michigan to receive this award, so kind of a big deal.
Especially in the customer service area, absolutely.
Yeah. And now the next thing we want to talk about is some really good news.
Yes.
A big change for 2025. Most of you know the Medicare prescription drug plans have this dreaded thing called the Doughnut Hole, otherwise known as the coverage gap. In 2025, Medicare, no matter what plan you're on, no matter what carrier you're with, no matter if it's a Medicare Advantage plan or a standalone prescription drug plan, we are saying goodbye to the Doughnut Hole. It's going away. In years past, the Doughnut Hole allowed for an out-of-pocket cost of up to $8,000 for your prescriptions. That's been devastating for a lot of people. Mm-hmm. Now the max out-of-pocket for prescriptions, with that Doughnut Hole going away, is being lowered to $2,000.
And trust me, it's a ton easier to explain this to you than it ever was to explain that.
We never quite understood that.
It took me so long to get it. So now this is much easier for us to explain to you what's going on with the prescription drugs.
Yeah, it's really going to be saving so many of you from catastrophic drug costs, and we're so excited about this. The insulins are still going to have that $35 cap going into 2025, so we're just excited. We're finally seeing some relief for many of you when it comes to these prescription costs. And now we want to jump into some frequently asked questions. It's the questions that we kind of get every year. And so we want to just tackle these right off the bat. Laverna, I'll ask the questions,
Yep.
and then depending on who jumps at it first, we'll
Yep.
answer the questions
Sounds
together. So the first question is, when is the enrollment period?
October 15th to December 7th.
Every year.
Yep.
Every year.
And yes,
October.
we're slammed during that period of time,
Yep.
so bear with us.
Yeah, bear with us during October 15th through December 7th. If you have to leave a message or an email, rest assured, we
Right.
will get back with you.
Oh, yeah.
The next question. Do I have to do anything to continue with my plan if I'm happy with it?
No, it will automatically renew each year. There's nothing you have to do.
Nothing to sign, nothing to click.
Nothing.
It just automatically renews. Perfect. All right, so if I'm on a plan that has a premium, should I change to a $0 plan?
Maybe.
Right.
So just what I would encourage you to do is consult with us,
Yep.
because we can guide you in what we think is the best avenue for you and explain why.
Exactly. And that goes for the Medigap policies as well.
Oh, yes.
If you're on a Medigap policy and that premium is getting bigger and bigger and bigger as they do,
Yep,
it may be a good idea to just do a check-in.
absolutely.
All right, next question. If I want to add dental or vision to my plan or cancel the dental or vision from my plan, that extra, what do I do?
We want you to contact us and we will send you a form.
Yes. This is probably a good
Yeah.
spot for us to talk to you about Shay Griffith, who is joining our team for this enrollment period. Shay's worked with Ford Insurance for for almost a couple years now, and we're recruiting her to help us out during this annual enrollment period because we do get so slammed with phone calls and emails. We want to make sure we're serving you the best that we can. And so you guys are going to love Shay.
She's just the sweetest personality.
She's a doll. She's great. She's efficient. She's smart. And
She
she's
wants to help.
She wants to help.
Yeah.
So what we are going to do, Laverna and I, we're going to consult with you. We're going to consult with you. Do you like the plan you're on? Is it the best fit for you? If we decide that, you know what, I think we're going to recommend some changes here. We're going to transfer you over to Shay, and she's going to finish that application and get everything into effect and pushed through for you in a real timely way. So that's exciting for us.
We're very excited to get things done
Yep.
considerably faster than what we
Yeah.
have in the past.
We
So,
think you'll like Shay too.
oh, me too.
So,
yeah.
All right, so next question. What do I do if I want to change my Medicare plan?
Okay, and just again, contact us and we will help you navigate through that change. And
Yep.
Shay will assist you on the other end as we go through those changes.
That's right.
Or that navigation for you.
That's right.
Do I need to show my red, white, and blue Medicare card to the doctor?
You know, you don't. If you're on the Medicare Advantage plan, the answer is no. You just need to show your insurance card from the carrier, whether that's Priority Health or the Blue Cross Blue Shield card. That's the only one you're showing. However, if you are on a Medigap policy or even a dual special needs policy, you'll want to be showing your red, white, and blue Medicare card, your insurance card, and if you're on the dual plan, your Medicaid card.
Right,
So
right. Do I get a separate dental and vision card?
again, if you're on the Advantage plan, it's a package deal. So everything is on that one card, from your dental, vision, hearing,
Gym
prescription, gym membership, all of those things is going to be on that one card.
Very good. Will I get a new card and an over-the-counter card for 2025?
Yeah, so they will be sending out new over-the-counter cards. Now, I know last year this was an issue for some of you, and we told you to throw them away, and then, oh my gosh, they changed it at the last minute and said, no,
Don't
they were
throw
supposed
away.
to use them. I can assure you this year they are sending new over-the-counter cards as they are changing vendors.
Right.
So it will be a new over-the-counter card from a new vendor this year.
And new Priority Health cards. New, you're going to get
Everything's
all new
gonna new.
everything this year. So
Yep. So 2024 will be done, and you'll get all new for 2025. So you guys, that's it. That concludes our Medicare presentation this year. We just want to thank you for the time of listening to these updates. We want to thank you for really being awesome clients for us. We enjoy working with you. We enjoy hearing from you. But hopefully this answered a lot of your questions, and unless something comes up, we don't need to hear from you on the plan changes. So just let us know if there's anything we can help with, and we'd be happy to help you along. Thank you.
Thank you.